Let's talk about lasers.
In essence, a sophisticated heat beam.
I'm going to talk to you about the new UltraClear laser versus the older CO2 laser. I'm going to talk to you about technology, advantages and disadvantages, and healing times. Stay tuned to the end and I'll let you know how much each of these procedures cost.
Begin laser ignition sequence.
For technology, we usually talk about wavelength. The CO2 laser goes deeper. The UltraClear laser is more superficial. The CO2 laser is kind of like your old Model T. The UltraClear laser is sleek. It has a single fiber, which gives you a lot more efficient treatment. With the UltraClear laser, it's quick. You could do it in 10 to 15 minutes. Most people don't need anything for pain. Another huge advantage is skin type. When we do the CO2 laser, which used to be called the UltraPulse, we use that for skin types 1, 2, 3. That's kind of white and a little pigmentation. As you get into more pigmentation and darker skin, then you can't use a CO2 laser. But the good news is, with the modern standard, the UltraClear, we can use it for all skin types. So let's talk about recovery. The advantage of a CO2 laser is it's kind of one and done. But the disadvantage is you're going to be pink for a week to 10 days. You can put on makeup, but you're going to be kind of pinkish red. You get out of a shower, you get out of a swimming pool, you got to cover it up with makeup. If you do it around your eyes, it's pretty easy to cover it up. You do full face, that's a challenge. The other side is you look at UltraClear and you're doing a series, so you're building up the maintenance. So you're healed in a week. You can do anything you want. You can have it done on Monday and be at a social function on Saturday, and you're in good shape. So the recovery is a big difference. It all depends on, are you the kind of person that likes to be one and done and that's it? Or are you the kind of person that likes to do kind of baby steps and always maintain? If you like this video, please make sure to subscribe. When we talk about cost involved, I like to give full transparency. One of the advantages I have is I'm offering both technologies, so I'm not biased to either one. To me, it's educational. I want you to do the technology, do the recovery, do the price point that fits into what your goals are. So if you're having surgery, then we're usually going to recommend the CO2 because you're recovering anyway. And you're also paying for things like anesthesia and recovery. You're taking your medications and things. You're out of work for a few days. If you're going to do UltraClear, you don't have those added costs and you're not planning on those. So when you really do a cost-benefit analysis and you think of the whole picture, you have to think about there's other things besides just the cost of the procedure. That's why I tend to recommend more the CO2 with surgery and the UltraClear, kind of our new standard for more outpatient clinic as a series. People ask me, which laser do I use? When do I use CO2? When do I use UltraClear? This is basically how you should think of it. The CO2 laser takes longer to heal, it's more involved, it's uncomfortable, so we tend to use it when we do surgery. We're trying to get a big result with one treatment. UltraClear, on the other hand, is what we call a non-surgical laser. We're using it in the clinic. We're using it for series. We're using it for lunchtime procedures to invest in your skin, to have maintenance, and to keep that going and building that collagen and that magical glow over time. So think of it like CO2 is a gold standard, but it's really a surgical laser. UltraClear is what I call the new standard, but it's non-surgical. So if you want non-surgical lunchtime maintenance, let's go with a series of UltraClear. If you want a one and done and healing's not a big deal, let's go with CO2.
Begin laser ignition!
If you like this video, please make sure to subscribe for more content to come.